My name is Bob Price. I'm from Austintown, Ohio. I'm a former student of John Russo, and I'm doing okay. If you're a licensed driver in Ohio, you're aware of the fact that when you get your driver's license, you're required to buy liability insurance, even if you do not have a car, because the state of Ohio requires it. It's mandatory. If you don't have that liability insurance and you drive a car, or even if you don't have the liability insurance and you have a license, they'll take your license away. If they take your license away and you drive a car and you get caught, you're subject to 6 months imprisonment and a $1,500 fine. It's a form of insurance. The idea is to spread the risk, raise the benefits, provide protection for all, and not coincidentally, increase profits for insurance companies. And I've never heard anybody complaining about it, particularly my conservative friends. How is this inconsistent with the complaints that I hear about providing coverage for every individual who requires health care?
It's not, as far as I'm concerned. In fact, 80 seconds left. I mean, it makes sense. I mean, it's exactly right. That's one of the ironies of this. The insurance companies are going to get 40 million new customers. At least. I mean, they'll probably get more than that because some people who have insurance will go into the exchange and get different kind of more, perhaps better insurance. So the insurance companies some will go into the public option, of course. The insurance companies will get tens of millions of new insurance customers. And that just says to me that it makes sense for them too. It makes sense for the whole country that way.
Senator Brown, I'm from Poland and Youngstown State University. I happen to grow up in another valley, the Mon Valley in western Pennsylvania, but same community. I grew up blue collar, and in my community, leaders were expected to be tough, direct, and of course to be reckoned with. I know you don't like speculating, but do you think that our current president understands the kind of leadership that working class communities are looking for?
I do. I think he's. I don't think he's proved it yet, but I think he does. I think he is. I think he's reflected on the world and on life more than probably any 40-something-year-old I've ever met. I mean, he's examined the way he grew up, the fact he was biracial and raised by a white grandmother. I don't want to do too much psychobabble here, but I think it's pretty clear that he's really thought things, in an intellectual way, thought things through.
Good evening, Senator. My name is David Yash from Struthers. My concerns are with the funding of this bill. I'd like a little bit more clarity on it, get it somewhere other than mainstream media. Is this bill going to be funded by just people who choose to take the public option through the government, or is there tax dollars coming from other people who choose not to take the health option by the government?
Good question, Dave. The bill is it is funded a bunch of ways. There is no government subsidy in the public option per se, other than when it's started. When we create the public option, there will be government money put in just to capitalize it as an insurance company. It has to be the money that is all paid back in a relatively short couple, maybe 3 years. I forget what the bill says, 2 or 3 years. Since you read it, is it 2 or 3? Quick. Number one. Number two, there are subsidies in the bill for anybody that's lower income. That's a full set. If you're making $20,000 a year, you will get a full health care subsidy of many $1,000s, several $1,000s. And you can take that subsidy. You don't get the cash, but you can take the subsidy and it can go to Aetna for private insurance, or it can go to the public option. So it's your choice where you want to put that money after you decide that way. In terms of paying for the bill overall, it's less expensive than it looks, but it's very expensive.
Hi, I'm Leonard Christ. I live in Youngstown. I feel like the fact that the health insurance that's being proposed here is really a mandatory insurance, more like car insurance than any kind of socialized or universal policy. That's getting glossed over by a lot of the liberals that talk about it and praise it, and that seems to be almost like a tax. That's just a comment. But what are the proposed penalties if a person doesn't pay for their health insurance? Or
if a person, that's a good question. If a person decides, I mean, the theory behind everybody getting insurance is that we want young, healthy people to have insurance. Well, a couple of things. We want young, healthy people to have insurance because insurance works best if it's spread among the whole population. And we also know that a young person who, of course, you as a young person, if you're like my kids and most people your age, think you're going to live forever. Well, you probably won't, but you think you will. That young people often will not choose to get insurance, and then they get a motorcycle accident, and we end up through, the hospital ends up eating the costs or passing the costs on or something of hundreds of thousands of dollars. And so all of that is why we want young people in the system, everybody in the system. You're right. I mean, the penalty will be a fine. It's not set. The amount of dollars is not set. It'll probably be, a few $100s. It won't be so exorbitantly expensive that if you have some money you can't pay it and not be insured. But I think that very few people will choose to do that because it's better to have insurance, and if you're low income, you get a lot of help from the government.
My name is Maggie Lorenzi, Youngstown all my life. You can raise my kids here. And when I read something, it doesn't matter to me who's written it, as important as the context is. I can actually say, call me nuts, I have read HR 3200, and I have read all 600 pages of the Health Senate Committee, your committee's bill. All of you that go to Washington are in Washington, and you are U.S. senators and U.S. congressmen, but you are representing your states. I noticed in both of these that how are our states, the state of Ohio had to fill holes in its budget. Not only that, we're looking at our credit ratings going down, yet both those bills are putting extra pressure on the states through Medicaid and through having to reach percentages of these federal grants. I want to know why and what assistance there's truly going to be to the state.
You're the only person I know that's read, including people I know in Washington, have actually read both the Senate and the House bill. I can't believe you read. I believe you. I just can't believe you. I read the Senate bill. I didn't read the House bill, but I know that both do that. One of the Senate bill actually doesn't have the Medicaid expansion because my committee, the Health Committee, couldn't do it. There's a reference to it, but it can't really do it. It's got to be the other. This is way too inside baseball. It's got to be the other Senate committee that has what's called jurisdiction over Medicaid that we don't have. But the House version does have Medicaid expansion, and our intention is the Senate version have it too. Medicaid is a less expensive way to provide health care than private insurance, significantly less so. A lot of providers would argue that's because it doesn't reimburse nearly at the level that most private insurance, nor even the level that Medicare does. But Medicaid also does a lot of things pretty smart, does a lot of things well that enable it to keep its costs lower. To direct answer your question, it troubles me too how we're going to do this, but the expansion of Medicare for the first 2 or 3 years will be paid for totally by the federal government. Beyond that is less clear at this point, so your criticism is justified.
First of all, I just want to thank you for your service and to make this healthcare reform happen.
You get to do it. Thank you.
I'm only 23, but I can say I really wish this happened a long time ago. My question is to you is how can we, as citizens of Ohio, help you get this bill passed as soon as possible?
Just do what I can tell you. I mean, I can tell you could be persuasive and talk to people, talk to your friend. I mean, the more support we build for this, the more that it becomes increasingly a mainstream position in this country that we need. That it's the values of the humaneness of this country, and the values of this country that everybody has health insurance, that people can make decisions of getting a new job without having to worry about insurance. I don't want you when I don't know if you're in Youngstown State now, but I don't want you when you graduate and go out looking for a job if you're afraid of health issues, if you have something that you have to go out and look for a certain kind of job just so you can get health care. I don't want you to have to do that. I want you to have the freedom to develop your own skills and your own talents in a way without that consideration. I want that for all Americans. And I think everything you do to go on the internet and build support for this, the more letters and more emails I get, the stronger I can be. The more emails and letters that George Voinovich gets, perhaps you can bring him along. Tim Ryan doesn't need much push, but he doesn't need any push on this. But he gets lots of letters and support, emails, calls. All that really matters. Representative democracy really works. I've seen it work lots of times, and your involvement in it can matter. So thank you for that.